Born in 1926, nursing diploma from Medical College, New York, Bachelor of Science in Public Health Nursing from St. John's University, New York, Master of Arts in Mental Health Nursing from Columbia University, New York, Associate Professor at Yale School of Nursing, where she was Director of the Graduate Program in Mental Health Psychiatric Nursing. Sandoz theory was developed in late 1950s from observations she recorded between a nurse and patient. Despite her efforts, she was only able to categorize the records as good or bad nursing. From these observations, she formulated the deliberative nursing process. Investigator of the National Institute of Mental Health, New York. In 1961, she wrote her first book about the theory of the dynamic nurse-patient relationship. She furthered the development of her theory when at McLean Hospital in Belmont, Master of Arts as a director of RSA. In 1972, she wrote her second book titled The Discipline and Teaching of Nursing Processes. Orlando held various positions in the Boston area, was a board member of Harvard Community Health Plan, and served as both a national and international consultant.
Major assumptions. Nursing deals with people, environment, and health. Patients need help in communicating their needs. They are uncomfortable, ambivalent about dependency needs. Patients are unique and individual in their responses. In some cases, the patient cannot state the nature and meaning of their distress without the nurse's help. First, the nurse must establish a helpful relationship with the patient. Nurses are concerned with the needs that patients cannot meet on their own.
Nursing process: assess, diagnose, plan, implement, evaluate. Assess: gather information about the patient's condition. Diagnose: identify the patient's problems. Plan: set goals of care and desired outcomes and identify appropriate nursing actions. Implement: perform the nursing action identified in planning. Evaluate: determine if goals and expected outcomes are achieved.
Major components of her theory: identify needs of the patient, patient behavior, verbal or nonverbal communication, response of the nurse, nursing action. Major components of her theory: understanding the meaning of patient behavior influenced by nurses' perceptions, thoughts, and feelings. Use observations to detect patient behavior to discover distress and meaning. Nurse-patient interactions are unique, complex, and a dynamic process. Major components of her theory continued. Nurse helps patient express and understand meaning of behavior. Nursing action is based on distress experienced and expressed by patient. Professional nursing, an independent role from physician and other healthcare providers.
Patient encounter: patient's verbal and nonverbal language, sense of helplessness. Nurse's response: exploration of patient's behavior. Nurse's action: a deliberative approach, evidence-based, and patient's reaction: need for help resolved.
CNO practices: practice standards in regards to relationships, professional relationships, and leadership. Therapeutic nursing: integration of a CNO practice standard. In any nursing situation, nursing practice standards must be followed.
Created using Powtoon.